Up on
Recording in
our
progress.
recent announcement. We're pretty excited about this opportunity for Beacon Health System to further expand into Michigan market and serve the communities in Kalamazoo, Allegan, Plainwell, and Dowagiac. And so certainly we're open to receive any questions you might have about our recent announcement.
One question from WWMT-TV, Josh Sanchez, WWMT-TV in the Kalamazoo studio. Can you tell us a little bit more about essentially how long has these conversations been going, and what inspired this decision to acquire some of these locations in Southwest Michigan?
Sure. Thanks for the question. You know, the conversations started probably late last year. Ascension had reached out and asked about our interest, and they reached out, I think, to several parties, and they requested that organizations submit, if you will, a letter of interest in pursuing more conversations or seeking more details about the organization and the opportunity to work with that organization. We obviously did that. We submitted a letter of interest, and for us, you know, we had acquired Three Rivers Hospital in Three Rivers, Michigan, a few years ago when they had reached out to us. And you know, I should probably back up and just talk a little bit about Beacon Health System. You know, we were formed in 2011 because two independent hospitals came together to form a locally governed, locally led healthcare system. And really that's at the foundational kind of core belief of our organization. And so as we've grown with these other hospitals, Bremen Hospital and Three Rivers Hospital, it was when those communities approached us and really bought into that model of governance, leadership, and delivery of services in the local community. And so when Ascension did that, you know, we looked at the Kalamazoo market, if you will, and thought about proximity. We thought about those communities. We thought about, does our model work there? Did we think we could enhance care, bring value to those communities? And really, when we did our due diligence and investigated what the opportunity looked like, that's really what got our attention and our interest, was the opportunity to do that. And we're excited about it. We've had a track record of success doing this with the communities we've gone into. You know, we've been successful over time. And I think that's important to be able to bring to communities you go into. And again, it's this commitment to local governance, local leadership, local delivery of healthcare, investment in technology, investment in people, and enhancing what's available in the community.
Excellent. Thank you.
Hi, my name is Juliana with WSBT. Question for you. So once this transaction is complete, are there any changes the community or people that frequent these facilities can expect to see?
Thanks for the question. What I would say is, you know, some of those changes may take some time. You know, nothing happens immediately per se. I think one of the things that people might notice quickly is we will standardize our information technology systems. So for example, we have some advanced capabilities in online scheduling that isn't currently available on their system. And so in this market, a patient can go on to our system and schedule an appointment with the doctor. That doctor orders a test. The patient, for some of our testing, can go in, self-schedule themselves. That's a time convenient for them. So that might be a change that's more immediate in those markets because we plan to do that day one. We plan to get those things happening as soon as possible. And so that would be a change you might see. You know, we hope our goal, I shouldn't say hope, but our goal is to maintain those services they have. Obviously, keep the physicians they've got, the great staff they've got. We don't want to see disruption in care. We want to see those things continue. But over time, we want to enhance those services. We want to add additional physicians. We want to add additional specialties. That's what we've done in the other communities we've gone to. We really believe that healthcare is local, and that means we would like for people to get as much care as they can close to home. Now, in some of the smaller communities, can they get everything? No, they can't. But what they can get, we'd like to be able to do that. And so providing access is important. So again, I think over time you'll see better access to different types of services and specialties. So that would be another change that you would see.
Thank you.
This is Autumn Pitcher with News Channel 3. My question kind of goes off of that. What does Beacon hope to bring that was maybe a shortfall of Ascension?
Well, Ascension's always done a great job. I mean, they've been in those markets, in those communities for over 100 years in Kalamazoo and in those other small communities. So they've always done a great job. I think, for what we can add to that is, we have a lot of great specialties in our organization that I think we have experience running, delivering great care, and we can just enhance what's already there. I think bring new technologies, new our EHR system, kind of bring it to current state, and so it's I really don't I'm not going to point a finger at any particular thing and say, oh, we're much better at this or that, but I think it is about the stability we bring over time. We've had a long track record of attracting highly talented physicians and staff and keeping them. We have very low turnover of our clinical staff at Beacon. And I think that has a lot to do with our culture, and we plan to bring that to these facilities as well. Stability means a lot, especially when you're talking about that patient provider or patient physician relationship. People want to be able to see their doctor or their nurse practitioner or the nursing staff. They want to see those people over time, and we've got a pretty good track record with that.
Thank you. And that's something that Ascension did mention for this. They said that they had challenges with staffing shortages. Is that something that you anticipate within Beacon, or do you think that when you guys step in that you will have good luck with that?
Yeah, we've done a couple creative things. I'll give you an example. A few years ago during the pandemic, there was this, and there always is a nursing shortage, right? There's been this nursing shortage for years, but certainly during the pandemic, it just increased dramatically. And a lot of organizations had to go to traveler staff or agency staff, and we did as well initially. But very quickly, we pivoted and we developed a program with Ivy Tech, our local technical college, and created basically the Beacon Scholars Program, where we help pay for the education of nurses. And for that, they make a commitment to come to Beacon facilities. And we're now graduating a number of nurses that fill our openings, and our turnover rate has dropped dramatically. We're in the single digits with turnover in our nursing, inpatient nursing positions. And so, we're willing to make some of those sorts of decisions that support the long-term success of having staff available. Now, I will tell you, we still have openings. We're not perfect, but we're willing to make some of those decisions and investments for the long-term success, and we'll bring some of those same sorts of thinking to address any shortages that exist at the facilities today.
Thank you.
You're welcome.
Craig, well, real quick, Ed Sumler, South Bend Tribune. Craig, real simple questions. Do you have a closer date on the closing?
Yeah, sometime this summer. There's some regulatory things that we need to go through, or kind of checkpoints. We have to file with both the Indiana Attorney General's office and the Michigan Attorney General's office as a not-for-profit community asset. That's something we have to do, is get the approval from the state. They want to make sure that we're complying with all the rules and regulations. And so those are two of the things that we're processing through. Those were filed. So they'll need time to kind of review this relationship and give their approvals. And with that, we hope to be able to, close out this transaction sometime this summer. So I can't give you an exact date at this time because, they may have some questions, some things we need to follow up on. We just don't know at this point.
Can you reveal a price for this merger?
We're not disclosing that.
Just asking.
Yeah. So, but thank you for asking. Yeah, I understand.
Similar to other acquisitions you have made, Beacon has made in the past, there will be local governing boards for these Michigan hospitals. Okay.
Yeah, I'm glad you asked that because that is really something core to Beacon. So Beacon Health System, as a not-for-profit community governed organization, we have over 100 community members who volunteer their time. So it starts with our system board, right? So I always say they're my boss. I have 14 community members that sit on our health system board that are voluntary people out of our community, spend their time, their talent to help guide and counsel and provide oversight of the health system. We then have subsidiary boards at each of the facilities that provide some of that guidance and counsel at each of those facilities. So Elkhart, Memorial, Three Rivers, Bremen, right now, the medical group, they all have subsidiary boards. And then we have committees of our governance, finance committee, audit, investment quality committee. And so we have members, over 100 people throughout our community volunteer their time to sit on those committees, help us, the leadership, govern the organization. And we will establish that same governance for those facilities that we're taking on and bringing into Beacon. And we believe heavily that those community relationships matter a lot.
Greg, could the people from the Michigan hospitals or those board members end up on the overall Beacon Health Board also?
So sure, they could. What we've typically done is we immediately invite those individuals to serve on some of our committees, so they begin to get familiar with Beacon. And ultimately, it's what they call a self-perpetuating board. And so the board elects, kind of those new board members as their terms roll off. And so eventually someone from those communities will absolutely have those opportunities to serve on the health system board. We'd love to have that sort of involvement and inclusion from all those communities, because that's what we're all about.
I believe you've been told a news channel that one of the advantages was having access to a richer residency program in Michigan.
Yeah. So
that gives you a better pipeline for physicians?
It absolutely does. I'm glad you asked that question. It was one of the things that caught our interest was that Ascension has been a joint venture partner, if you will, in an organization called WMed that is basically sponsors the rotations, if you will, of residents. And so the number actually, I think, is almost 240 residents and 14 different residencies and fellowships. And, most of you probably know recruiting and retaining, finding physicians for communities is not that easy. And certainly this will give us pipelines to new young talent. And we're excited about that because we'd like to think once they get exposed to Beacon and the Ascension facilities run and operated by Beacon, that they'll choose ultimately to stay with us. We have currently a family practice residency and sports medicine fellowship and an OB fellowship, where we take a lot of pride in that program. Our leadership does a great job there, and we love it when we're able to get residents to stay in our communities.
Is there better also, is this true that there is better reimbursement on some things in Michigan versus Indiana?
So Michigan, I will tell you, Michigan has done a really nice job with how they work with the federal government on the Medicaid program. And that's in the news a lot lately at the federal level about some cuts that might be planned at the federal level. And that's very concerning. What Michigan did a few years ago was it's called federal leveraging, where you have to put up money in the state as basically a match to what's available at the federal level. And Michigan did a really good job with that. So the Medicaid funding in Michigan is much better than it is in Indiana. And why does that matter? Well, the issue in Indiana right now that's being talked about is how much commercial rates are in Indiana. And the reason commercial rates are higher in Indiana than they are in Michigan is what's called cost shifting, is because what doesn't get reimbursed by Medicaid is often cost shifted to the commercial population. And so when you look at Michigan as compared to Indiana, the commercial rates are very different. And it's frustrating to the commercial population, the employers. And so the legislation in Indiana has taken up this issue, and they're putting pressure on that, talking about price caps in Indiana on the commercial rates. Yet, we haven't leveraged federal dollars to the same way Michigan has. And so it is I will just say, it's a more friendly, supportive state to be able to deliver healthcare services and have them be sustainable. That won't be a very popular statement in Indiana, but it's something that we've been working with the legislators on. They're looking at it. They're trying to get there. We're trying to be very supportive through the process, and we understand why people are frustrated. Healthcare is expensive, and the better we can balance those scales and distribute those costs, the better off we're all going to be. And I would say Michigan's done a pretty good job of that.
Thank you.
Hello, my name is Eniola with Inside Indiana Business. And I was wondering if the Ascension name is going to be retained or if it will become Beacon.
Our plan is that we will use the Beacon moniker or name for those facilities. We think it's important that people connect those to our brand and who we are and the services we provide.
Wonderful. And are there any planned investments in facility upgrades or new technology for the hospitals?
So I can't give you any specific on the facilities or specific technologies other than, as I mentioned earlier, we will be standardizing or upgrading, uplifting, if you will, their electronic health records platform. We're going to be doing that with our own here and then bring that same standard to apply with the Ascension facilities. The good news is we're both Oracle Cerner clients, if you will. So there's kind of a same platform. We just have different versions. And so we'll be standardizing that in that process from day one. So that's an investment we're making right out of the gate. And then we'll evaluate all the other technologies that they have in the organization in terms of the imaging technologies, other patient care technologies, and really develop a schedule and a plan of what needs to happen there.
Wonderful. And how does this acquisition fit into Beacon's long-term growth strategy?
You know, we've been, I always say that we've been opportunistic. And when we look at those growth opportunities that come forward, and we evaluate them to see if they fit with our model and if we believe we can make a difference. And so again, when we looked at this opportunity that Ascension presents, it did fit from a geography, right? It's an hour and 15 minutes to Kalamazoo. And that supports our belief in kind of remaining local, regional. Relationships matter, that you can get there and see someone in person, meet with them, talk with them, plan something, and that's still possible to do. If it was 5-6 hours away, that's a different equation. And so it fit very well with the opportunity for us to continue to grow thoughtfully. And make a difference. I mean, ultimately, our mission statement is pretty simple. It's 3 things. It's we deliver outstanding care, we inspire health, and we connect with heart. And if you think about it, that within our governance model, meaning we have these local community volunteer people, can we deliver that mission in our governance model with this acquisition? And the answer was yes, we believe we can, and make a difference in those communities. And so it fit really nicely with our thoughts and our plans, and we're excited about it.
Great. And what would be your message to patients who may be feeling some kind of way about the acquisition, just what would you say to them?
Well, one, I would have them look us up. Go online to beaconhealthsystem.org. We have a lot of good information on our website. They can see who we are, what we're all about, what our history has been, the type of providers that we have, our physicians and our nurse practitioners. And, I reference our mission statement because we believe in it. So I would say you start there, right? Find out a little bit about the organization. But what I would say is just that we're excited to come into those communities and enhance care, make it accessible, be available to those communities, and do a great job for them. Healthcare isn't easy to navigate, and it's complex, and at times it can be, produce anxiety for people. And I always tell folks in our own communities right now, I want them to feel like they know us, that they know somebody in our organization, that they can pick up a phone and ask a question and get an answer to that and get connected somewhere within our organization and get the help and support they need. And again, it goes back to our belief in that community-based relationship model, having those local board members, having people, our leadership living in the communities, just being available. All that matters. And so I would say those sorts of things, those community members, that's the type of organization we are. And as I was telling someone earlier, those are a lot of words, but I think it's up to us to make sure our actions match that.
Wonderful. Thank you so much.
Greg, just kind of following on those questions, that answers what Michigan people have to gain by joining Beacon. What do existing Beacon people have to gain by this acquisition? Is it mostly the pipeline?
So I would say a couple things. I mean, when you say Beacon people, I think about the internal folks, right? So there will be.
I'm kind of referring to us who are customers down here.
Yeah, the community too, right? But I will start. Let me start with just the internal folks, right? Because it was interesting when we ended up acquiring Three Rivers. I had several of our employees who said, "Oh my gosh, this is so exciting because I live up there. I might end up taking a job at Three Rivers now that they're Beacon." And so we'll have some of that might happen. So it provides more opportunities for folks internally. So let's start there. So that's a great thing for everybody. You mentioned the other area that absolutely matters is the new opportunity to gain new talent and recruit physicians and have these new relationships. So that matters a lot. But I would say the other thing that I always go back to and I started with was our board and our leadership, myself included. We really believe that this issue of healthcare being local and this opportunity enables that. So if I were to say, would you want decisions being made for the healthcare in your communities to come from the region, or would you want them to come from far away, some faraway land? And would you want the people to be in those communities who are making those decisions? And this acquisition, this expansion allows us to continue that model. One of the things that's harder to do in healthcare is to be financially sustainable. With the cuts that we've already had and that they're talking about out of Washington, the things they're talking about at the state level, it's really hard. And so, part of this is finding more opportunities to be financially sustainable. And part of that comes from having a bigger base to look at and to find those opportunities. And so this will give us a longer runway of having that local governance model. That's one of the conclusions our board and leadership came to, that made a lot of sense for us and that we believed in that. Because, we don't believe that turning over leadership or governance to some other organization that's not in our community makes sense this time. It's just not the right thing. We don't want to see that happen. So I would say that's a really important aspect that we current people continue to receive the benefit of, is that for a long time to come, we want people who are governing and leading the organization to be from our communities locally and regionally. I think that matters a lot. There are, the other thing I haven't really talked much about is, when we looked at this, there are economies of scale, in terms of our ability to reduce some costs, because just our purchasing power goes up, our ability, especially on the supply side, that vendors, they're going to look at us very differently when we're buying supplies for the number of hospitals we're going to be working with now versus what we used to. And so bringing that to bear is an opportunity, hopefully, to stabilize the cost of care over time. So those are a few things I think about when I think about what the benefits are for kind of current Beacon, if you will.
Thank you.
We have time for one more question.
Heidi, that's a great voice.
It is. Okay, we want to thank you guys so much for tuning in today and for asking these questions of Craig. Yeah, thanks so much. And if you need anything else, you know where to reach me.
Thanks. Have a great day today.
Thank you.
Thank you.